Welcome to part 5 of nursing practice questions and answers about respiratory problems of the adult gland. Now let's start with the first question. The nurse is taking the history of a client with occupational lung disease. The nurse will ask the client whether the client wears which item during periods of exposure to silica particles. So these are the options. Option A, mask. Option B, gown. Option C, gloves. Option D, eye protection. Now for this question, the correct answer is option A, mask. Now let's move to the rationale. Occupational lung disease results from chronic excessive inhalation of particles of free crystalline silica dust. The client needs to wear a mask to limit inhalation of this substance, which can cause restrictive lung disease after years of exposure. Finally, options B, C, and D are not necessary. Now let's move to the second question. The nurse is instructing a hospitalized client with a diagnosis of emphysema about measures that will enhance the effectiveness of breathing during dysphenic periods. Which position will the nurse instruct the client to assume? So these are the options. Option A, sitting up in bed. Option B, side lying in bed. Option C, sitting in a recliner chair. Option D, sitting up and leaning on an overbed table. The correct answer for this question is option D, sitting up and leaning on an overbed table. Now let's move to the third question. The community health nurse is conducting an educational session with community members regarding the signs and symptoms associated with the tuberculosis. The nurse informs the participant that tuberculosis is considered as a diagnosis if which signs and symptoms are present. Select all that apply. So these are the options. Option A, dyspnea. Option B, headache. Option C, night sweats. Option D, a bloody productive cough. Option E, a cough with the expiration of mucoid sputum. The correct answer for this question is options A, dyspnea. Option C, night sweats. Option D, a bloody productive cough. And option E, a cough with the expiration of mucoid sputum. Finally, let's move to the fourth question. The nurse performs an admission assessment on a client with a diagnosis of tuberculosis. The nurse will check the results of which diagnostic test that will confirm this diagnosis. So these are the options. Option A, chest X-ray. Option B, bronchoscopy. Option C, sputum culture. Option D, tuberculin skin test. The correct answer for this question is option C, sputum culture. Now, in my presentation, my reference book have used Saunders Comprehensive Review for the NCLEX RN Examination 9th edition.